Hey, and welcome to the Friendly Viking podcast. Cody Oakland here with Lee Simpson. And on today's segment, we're going to talk about effective dosing, right? So you come in with some type of issue. There are clearly many different protocols, different products, but what it really comes down to then is how to set up the dosing for an individual based on a particular problem. Whether it's a dis-ease, whether it's a cancer, whether it's anxiety, whether it's any multitude of issues that cannabis oil can really help with. So I'm going to hit the expert over here, Lee, to kind of go through a few different iterations of dosing for a few different particular issues.
What we usually see is that a successful patient is a patient that didn't quit. Yeah. And if you provide people with education and a proper dosing schedule on the front end that they understand and is somewhat familiar to them, like the way pharmaceuticals are dispensed and controlled, then that there's comfort there. There's a basic understanding of how that works, right? And the idea is, because cannabis has such a stigma attached to it, a medical cannabis company, like with whoever you are, whatever company it is, whatever organization, needs to have a more than conservative or a more than responsible approach, a more than regular, more than reliable, more than methodical approach to the dosing. And, to be successful, you can't quit. And one thing that all successful patients have in common with our cannabis protocols is that they took their medicine as suggested and they took all of it over the period of time that they were supposed to. And so if you want to have miraculous results that you see online or in Sanjay Gupta's videos, or if you've heard of Charlotte and Charlotte's Web, or, Rick Simpson and, cancer, going away without explanation. If you want to participate in that group of people, then you need to take all of your medicine, right?
It's what's good for you.
Yes. And you need to do that in a structured, organized way from people that understand the medicine itself, but also understand how to interact with you based on the changes that you need to make on a daily basis, because everybody's different. So yes. Let me ask you a question. Like, would you want your wife, or your mother to take, this medicine unsupervised?
I wouldn't want anybody I know to take anything unsupervised, especially if it's going to have some type of impact on their health. Mm-hmm. Right? So I wouldn't ask somebody on the corner how much of this I should take of a pharmaceutical. I would want to have a reliable, consistent evaluation of what that looks like. And so I would want a dosing specialist.
Yeah. So in the current model we have dispensaries, which are like liquor stores, and we send mom into a liquor store to get information about a product that she's been terrified of her whole life. And so how do we responsibly handle somebody that doesn't even want to be there, or is just having anxiety about the whole process itself, because over the course of their life they've just learned that it's just not good for them, or it's a scary illicit thing, it's a dangerous thing. And then what is also true is, if you take too many cannabinoids, you're going to get too high and you're going to be uncomfortable and you're going to quit. So dosing is I would say it's more important than the quality of the medicine, but it is just as important as the quality of the medicine, because your dosing specialist is the one that's going to keep you comfortable and keep you informed and, allow you to take all your medicine so you're successful. So, where do you start? Right?
Yeah. Well, and I think one of those first hurdles is gaining trust.
Mm-hmm. Yeah. So trust starts with reliable, methodical medicines. So trust begins with the bottles on the King Harvest product site. It doesn't begin with the FECO necessarily, unless you're already a pro. when you are using King Harvest tinctures, as they're called, which are infused oil-based bottles, they come in different strengths, and we will start with usually the lightest bottle, the lightest concentration, or the 1x version of the medicine. And so in that 1x version, every drop of medicine is going to have only 1/2 of a milligram of cannabinoids. Every bottle has exactly 300 milligrams in the 1x version. And so if there's 600 total drops in the bottle, you're going to take like 1 drop is your beginning dose, right? Just to get your baseline. Make sure you don't feel it. And then we are going to titrate you up from there. Right?
Got it.
And so what is titration?
Are you asking me
Mm-hmm.
the amount that you would take to get a desired result?
Yeah. So we start with...
Was that a good answer?
It's a good answer. It's an incomplete answer.
Okay.
We start at a low level and we titrate up to the higher level where we consider that to be medically legitimate, right? Or enough medicine to achieve a result. So in terms of cannabis, you want to take 600 milligrams a day for 90 days. And you want to have a meaningful amount of CBD in there. So what we do is we start with the bottles, go very slowly, make sure that the patient doesn't get too high or altered, meaning
so they don't get uncomfortable and they lose trust.
And generally the baseline is that they don't feel it at all.
Yeah.
Right. And so you can go so slowly that you can titrate up somebody. You give them like 2 or 3 milligrams in the morning, 2 or 3 milligrams at night, and then, a nighttime version of the medicine, for sleep. You start titrating them up super slowly. Not only are they not going to necessarily feel it, but you're going to start giving them the anti-inflammatory and the medical benefit right away. And you're going to, by them not feeling it, and you prove to them that they're not going to feel it, they will trust you and they will take more medicine.
And their fear will subside.
Yeah. So typically a person is going to, and this is all goes with the dosing specialist, right? But typically a person is going to start with 3 to 5 drops under the tongue of a bottle that is the 1x version, right? Here we have the Synergy, right? And so you're going to just take literally 1, 2, 3 drops like this, right under the tongue, right? Tastes very much like cannabis.
It's delicious.
You can tell that it is full of medicine. And it immediately, by virtue of it going under the tongue, it immediately starts to cross the blood-brain barrier and it stimulates the endocannabinoid receptors throughout my head and my neck, right? Now I swallow some of that down as well. That goes through the liver, starts to stimulate the receptors throughout my organs and my abdomen, and starts to release the medicine, systemically throughout my whole system. So within minutes, orally within an hour, my body is immediately getting anti-inflammatory compounds. Within that first hour, if I'm going to feel it, I'll feel it psychoactively, it'll alter me, and it'll be such a small dose that it'll be comfortable and easy to manage, and it's not going to scare even your grandmother or a toddler or a puppy.
You can still do your taxes.
Yeah, you can go.
Although that's painful. But this has anti-inflammatory, so you'll get better.
So, you're interacting with your dosing specialist, on a daily basis, and what they're doing is giving you instructions for raising your levels. Your first dose is probably going to be 2 or 3 milligrams. You're going to, every 2 to 3 days, you're going to raise your levels up, and you're going to work towards taking a total volume of cannabinoids that is 600 milligrams per day. Once you're taking about 20 milligrams per dose with the drops, then what we do at night is we insert this, which is FECO, full extract cannabis oil, if you've heard about it in other episodes. This is an oral syringe that will contain a minimum of 600 milligrams of active cannabinoids, probably more like 800 milligrams in this syringe. And what we do is we make oral syringes for patients based on what is wrong with you. King Harvest makes strain-specific full extract cannabis oil that is specific to whatever diagnosis you have, right?
Got it.
So this, as an example, is 3 to 1. This is 3 parts THC indica with 1 part ACDC-based CBD. This works really well for my seizure disorder because it'll slow me down. It will have enough narcotic cannabinoids to slow me down. And at the same time, it has quite a bit of the ACDC-based CBD or cannabidiol, which stimulates my endocannabinoid system and keeps my neurological traffic happening efficiently and properly. I need to take about 300 milligrams of active cannabinoids a day to keep to keep seizure free, right? Mm-hmm. It allows me to not take any other pharmaceuticals. It allows me to sleep deeply and normally. I don't have any negative side effects from the cannabis oil. I don't have to take, pharmaceuticals. It's far less expensive than Western medicine.
Yeah, and not just in the cost financially, but the cost to your body.
Yeah. And my liver is getting better over time rather than getting worse over time. And this is also preventing other inflammation. Like as an example, I have a seizure disorder, but we also have neurological, like Parkinson's types disorders in our family. On my dad's side, my grandfather had a bout of Parkinson's. And so this keeps me further away from the inflammation that is in my genetics that would cause me to eventually get Parkinson's. If I have a seizure disorder, doesn't it make sense that I might eventually get Parkinson's? Don't they seem somehow related?
And, and so it will never have to necessarily express itself because the inflammation isn't there.
And the inflammation.
You make that connection?
Yeah, the inflammation isn't there. So if the inflammation isn't there, then the bad information isn't there, and your body doesn't start doing bad other things that it shouldn't be doing, which causes your eventual death. Right?
Bad begets bad.
Yeah, you get in a bad feedback loop, right?
Mm-hmm.
So cannabinoids can break that feedback loop, right? Whether it's on the ground floor, like inflammation, or if it's just a feedback loop, like you can't sleep because you have so much anxiety because you're a worrywart because of what happened to you when you were a kid, right? Yeah. And so we can break that feedback loop and get you sleeping, like with an example with a product like this, which is Founder's Reserve on wine. The Founder's Reserve is 4x, whereas opposed to this is 1x. This has 0.5 milligram per drop. The 2x has 1 milligram per drop. The 3x has 1.5 milligram per drop. And then the 4x, or the Founder's Reserve, my personal signature edition, has 2 full milligrams of active cannabinoids per drop. It's extremely strong, and it's formulated this powerfully, so you don't have to take very much medicine to get a result. And it's also, it becomes proportionally cheaper the stronger you buy it in whatever form it is. So as an example, I'm going to take 1 syringe of this, half a syringe of this tonight, and then I'm going to take probably 15 to 20 drops of this tonight to manage the anxiety as well, right? Mm-hmm. So King Harvest makes different bottles for different symptoms. So when we talk about a protocol and your overall dosing, what we do is we get the bottles together that match your symptoms. Usually it's going to be CBD Restore. It's going to be Synergy PM, maybe Uplift, right? You're going to take, and then you're going to use Green Emu as the topical. Okay.
Yeah, got it.
So with all the oral bottles, the tinctures, you're going to start with 3 to 5 drops. With the topicals, the Green Emu bottle is the topical. That's another wonderful way to get cannabinoids in your body. But the Green Emu, you're going to start with a quarter size drop on in your palm, and then you'll just apply it into the affected area. That's going to give you 12 to 15 milligrams. That's going to be about 30 drops in that little quarter size bottle. That's going to give you 10 to 15 milligrams that you're going to apply to the affected area. Topicals are usually 50-50 CBD and THC, and so it's going to be a good dose for pain and a good dose for anti-inflammatory. Like if you have a eczema, or if you have like back pain or a surgery site, Green Emu is wonderful local topical to replace the need for injected like Novocaine type stuff like that.
Yeah, site type of applications.
Local area site applications. And then if you take the medicine orally, it stimulates your system, handles all your pain management, right? The same way like opiates, it's identical to opiate pain management without the negative side effect.
Yeah.
So you start with the topicals in the bottles, you go slow, make it so like everything you feel is totally manageable, right? And then we introduce the full extract syringes by taking tiny doses of this by mouth at night. Eventually, you'll work up to taking a full, as I said before, 600 to 800 milligrams a day, depending on what is wrong with you. And the form of the medicine will be extracted to address your disease specifically. So the last thing I'll add is that FECO allows people to take extremely highly concentrated versions of the medicines orally, right? Processed, digested through the liver. Take enough compounds and take it in a meaningful way to like really start to reverse the underlying disease process. That is an extremely like narcotic and,
Yeah, I would imagine.
Way to go. So I think you've experienced that for yourself, actually. So rather than, accidentally taking too much medicine and being too high or uncomfortable or scared, which causes people to quit, an extremely popular option, like what we suggest with most patients, is to take some of your medicine orally, but to take the larger amount of the medicine rectally or through a suppository model. So we also specialize in the preparation and administration of suppositories.
Okay, perfect. So what's the mechanism physiologically, chemically, when you do it rectally?
Well, it's going to be identical to the oral administration. The idea is that you're stimulating cannabinoid receptors in different areas of the body. And so it stands to reason that if you have, say, like an organ cancer or abdominal cancer, then you're going to want to take more medicine through the liver, right? Mm-hmm. So if you use, obviously oral medicine gets it there, and then suppositories allow you to take a huge amount of medicine and it goes into the return part of the bloodstream where you're not psychoactively lit up or it doesn't narcotically affect you.
Okay, so that's the key for somebody who is in, say, really bad shape.
Yeah.
Coming end of life, possibly. And you say, we can get you up to a therapeutic amount, and here is how you're going to do it.
And so dosing specialists that work with people on the day-to-day, if you're somebody who's really like in late stage, they're in sort of like stage 4 hospice setting, that kind of thing, you really want to get a lot of medicine in them really quickly. And so suppository is, a wonderful way to get a lot of cannabinoid medicine administered and metabolized, right, quickly without the narcotic effect. You'll get a lot of pain relief out of it. And then the other benefit too is that you're administering medicine to the lower extremity of the body, so lower abdomen, bone cancer, lower cancers in the lower half, that kind of a thing. Uterine, exactly. So uterine, and we will also suggest that people will use suppository vaginally because, say that you have uterine or ovarian cancer or even dysplasia, right? Usually the bottles are enough to get rid of dysplasia, like really bad stage 4 cancer stuff. But if you are kind of catching it later and you have dysplasia and you're worried that you have ovarian cysts and cancer in your family and you don't want a hysterectomy, then in a lot of cases we'll do suppositories and a vaginal administration, so you get medicine delivered to all of the areas where the cannabinoid receptors are, and that's how you achieve the success.
Yeah. So would it be the same pathway vaginally than it would be rectally as far as being able to take a high dose?
So the vaginal administration is extremely narcotic, whereas rectal is not.
Got it.
So that's an important thing to note. If you don't want to get high, then don't put it in the front.
Yeah.
Exactly. And this is all TMI for a lot of people and a lot of us, but we need to start learning how to talk about these things. And
we get to talk to like adults because we're talking to adults, right?
Well, when you start to have command of the information, people start to talk to you about very vulnerable things. And early on, by being willing to help people would tell me very intimate details of their colon cancer, their rectal cancer, their their most intimate systems and processes. And, I started to wonder why they feel okay to tell me this, and they certainly don't feel compelled or safe to tell their doctors. And it sort of outlines the fact that we really, really are intimidated. We feel scared. We feel controlled. Most people don't even feel like they would be allowed to take control of their health.
Yeah, a lot of people feel embarrassed as well, and shame that they're in this situation.
Yeah. So, you as one of our, original patient care specialists, right?
Yep.
You saw firsthand front lines of the effects of overprescribing of pharmaceuticals, or the effects of chemotherapy and radiation, or
it's devastating.
Or the effects of long-term pharmaceuticals on the thyroid, right?
Liver gets beat to shit.
So,
there are other ways, people.
If you look at cannabis medicine as also from another standpoint, rather than A plus B equals C, like I have a disease, I take medicine, and now it's gone. If you look at this from an electrochemical perspective, like taking oxygen drops, like by virtue of taking cannabinoid medicine that's properly made and you stimulate your system, you have this exponential, like mysterious, beyond explanation result. So you have this whole mystery myth thing where cannabis seems to be like ridiculously good for everything, and then therefore that's total BS, right? But really what the mechanism is like we're so starved, we're so like lacking in nutrients and even ability to breathe and oxygenate. We're so starved on every single level: sunlight, nutritionally, hydration, every single level, minerally, that if you just give the body a little bit of food, it'll go for days, right? And what we're saying is that the Western world in pharmacology is so dishonest, and the FDA is so far off the reservation that most of what we understand to be disease is actually starvation and lack of oxygen. And it's the change of pH in our body. It's the change of the body's environment because we're starved and we can't breathe.
Well,
right?
That will be a completely stand on its own episode.
Yeah.
Because there is a lot to unpack on that type of topic with the FDA.
Yeah.
And what they perpetrate on humanity. But that'll be a story for another day.
Absolutely. So, the bottom line is with, dosing and FECO and dosing with cannabinoids, you want to start small. You want to graduate up to taking 600 to 800 milligrams a day. You're really smart to use oral and rectal administration as well as topical. And if you do that, your results are going to far exceed the success rates of Western medicine. If you combine it with Western medicine, then we'll safely say that you're probably not going to be, plagued by your illness anymore. Like if you do everything that you can and you take that responsibility for yourself, right, and you really come at this hard from a nutritional, cannabis perspective,
the other half of it,
then you're probably not going to be sick anymore.
And that's our goal.
Yeah. And that's our episode.
And that's the reason for this podcast.